Welcome back to Breakfast Central on News Central. Now, the News Central mobile app ensures that you stay in touch with the latest when it comes to news, sports, technology, and other information. Now, you can go ahead and download the News Central mobile app on your Android and your iOS store. We have coming up COVID-19 updates.
That's right. In COVID-19 updates, we do have Michael Ngene, who's on standby. Let's know what the latest is. We hear the Queen has indeed caught the bug, the virus out there in the UK. But let's start off with what's new. What do you have for us, Michael?
Yeah, good morning, Joe. Good morning, Oluchi. Good to be here. Now, let's start from home, Africa. Now, in a bid to achieve vaccine equity, the World Health Organization has selected Egypt, Kenya, Nigeria, Senegal, South Africa, and Tunisia as the first African countries that will receive the technology needed to produce the mRNA vaccines on the continent. This announcement was made by the WHO Director General Tedros Ghebreyesus during the European Union African Union Summit in Brussels on Friday. Let's take a listen to what he said during that summit.
Today, I'm delighted to announce the first 6 African countries that will receive technology from the hub to produce their own mRNA vaccines: Egypt, Kenya, Nigeria, Senegal, South Africa, and Tunisia. More than 80% of the population of Africa is yet to receive a single dose. Much of this inequity has been driven by the fact that globally vaccine production is concentrated in a few, mostly high.
Now, according to Ghebreyesus, he said that these countries, that is Nigeria and these other 5 African countries, have all applied and have been selected as the first technology recipients of the mRNA vaccine hub. Similarly, he also called for equitable access, as you could hear from the video, to vaccines worldwide to beat the COVID-19 pandemic, as Africa is lagging behind other continents in the global vaccination effort. Now, I'm going to take you straight up to, understanding what this mRNA vaccine is. But, Ghebreyesus also said that the best way to address health emergencies and reach universal health coverage is to significantly increase the capacity of all regions across the globe to manufacture the health products they need. Let me tell you about the mRNA Technology Hub. Now, according to the World Health Organization, the Global mRNA Technology Transfer Hub was established in the year 2021 to support manufacturers in low and middle income countries to produce their own vaccines. Yeah. We also brought you reports sometime 2 weeks back about South Africa opening up its own vaccination plant, and also Tanzania. Who would have believed that Tanzania, one country that had a president who never believed anything like COVID-19 existed, saying that they are ready to bring up and, of course, have their own COVID-19 manufacturing plant to run. Now, the technology will also ensure that the countries have all the necessary operating procedures and know how to manufacture vaccines at scale and, of course, according to international standards. I think this is actually good news, Joe and Oluchi. Since last 2 weeks now, we have been seeing news about, vaccines, ensuring that Africa has more vaccines, and this approval given to Nigeria and other African countries by the World Health Organization definitely is a right step in the right direction.
Well, it is good news at this point in time. I mean, we Africans have been given the opportunity to produce our own vaccines. Let's keep the standard international and ensure that we do not lower the standard or give opportunity for fakes. And being proactive, what happens 10 years down the line when we're no longer COVID-19 conscious? What happens to those plants? What happens to those people who have been given the opportunity to be employed? What happens then? We also need to think 10 years ahead.
Exactly. We're talking about 10 years ahead, you talked about a story earlier on where you talked about Zambia, winning the war against malaria. Now, these are some of the things. I personally believe that aside from talking about vaccination for COVID-19, we should also start looking at, making plans for, the malaria and, of course, other diseases that are ravaging some African countries, like the malaria, like the Ebola virus, all of this. But like you said, 10 years after now, what happens? But hey, let's move away from that and get you to something more global, if you would say. Britain's Queen Elizabeth has tested positive for COVID-19 and is said to be experiencing mild symptoms. Now, according to a statement from Buckingham Palace, the Queen will continue to receive medical attention and will follow all appropriate guidelines. Let me just show you real quick the tweet made by the Prime Minister talking about that particular incident. This is a quote, a tweet by the Prime Minister Boris Johnson. He said, and I quote, "I'm sure I speak for everyone in wishing Her Majesty the Queen a swift recovery from COVID and a rapid return to to vibrant, good health. Now, recall that Prince Charles, aged 73, that's the heir to the throne, earlier this month, pulled out of an event after contracting coronavirus for a second time and was said to have met the Queen just days before. We wish the Queen and, of course, the entire household there in Buckingham Palace the best and safest recovery ever. Okay, now the numbers. According to Africa Center for Disease Control, the continent has recorded over 11.4 million cases with over 247,000 deaths, while the number of recoveries in Africa has been pegged at 10.4 million. The virus is still out there, guys. Please do what you can. Use your face mask. Also, make sure you stay socially distanced if you're outside. And please don't forget that you still have the hand sanitizers. Make use of them. And please let us all do what we can to ensure that we eliminate the COVID-19 from the African continent and probably the entire world. Back to you guys.
All right, thank you so much, Michael. Just going to urge you to stay with us for a few seconds. Haven't taken a look at that COVID-19 updates. Of course, the sad story that the Queen has indeed contracted the virus. Hopefully she gets better, and that's exactly what's being worked on.